Hi everyone, I'm Tom, your navigator for this series from VisiQuest. Welcome to the second Discovery module on age-related macular degeneration, abbreviated AMD. In our first module, we learned that diagnosis is the start of our journey, and literally millions of people are already on that road. The question now is, how do you get on a heading that leads efficiently to best outcomes? You now know that there are different types of AMD, with the major difference being dry versus wet. How does your retina specialist sort through these variations so he or she can advise you on available treatment options? The key is imaging. Let's look at the amazing tools your ophthalmologist uses to really customize your care. Here's Dr. Beck.
Hello again. Most medical specialties rely on objective data, like blood pressure and numbers from blood tests. Well, retina is very different in that it's highly image-driven and therefore quite subjective. Trending patterns in thickness, contours, and colors is critically important in retinal care. So standard in-office testing includes color fundus photography, fluorescein angiography, and an incredibly useful tool called optical coherence tomography. And you'll hear this abbreviated as OCT.
First type of testing that they do is they photograph my eyes to see if there's been any change in the macular degeneration.
They take pictures of my eyes to see, if the eyes are getting better or if they're not doing so well.
He also showed me the picture of the test, and as a patient, I could see what he had been talking about.
The equipment necessary to perform these imaging tests has evolved significantly over just the past few years. This allows for detection of amazing detail. Modern imaging systems and their software are also more patient-friendly than ever before, mainly in terms of speed. Well, a fluorescein angiogram is the gold standard test for evaluating the status of blood vessels in and under the retina. This test still requires a highly skilled technician to capture timed images following dye injection. Let's sit in on an actual fluorescein study. An orange-colored dye called sodium fluorescein is injected into a vein, either in the hand or the forearm. The dye is not like iodine-based dyes used for contrast studies of the kidney and heart. Dye travels to the eye where retinal blood vessels are visible through a pupil already dilated with drops. And contrary to what you may think, there are no X-rays in this test. Abnormal vessels typically leak as the study progresses. Most angiogram cameras are now digital, so processing film isn't required. Your retinal physician can review your scan immediately to diagnose and make treatment recommendations. While much of the information we get from a fluorescein angiogram is subjective, certain objective data can be generated to help with specific treatment. Here, laser settings are being calculated for a treatment called photodynamic therapy. More on this treatment option later. Well, part of every fluorescein study is basic color fundus photography. Now, I should mention that fundus simply refers to the back of the eye. Trending macular changes with color fundus photos is very helpful, especially given the number of patients your retinal doctor sees.
None of it is painful. The bright light is very bright, and I find myself blinking afterwards, but it's something that they need, and so I'm happy to go through it. It's not painful, it's just very bright.
Here's a case where the patient reported progressive central vision loss. Comparison of the current findings with archived color fundus photos provided the answer. progression of dry disease over time. So here's an OCT scan being performed. The OCT gives a cross-sectional look at the retina. And a good analogy is examining a piece of plywood on edge. This test requires no contrast injection. It's very quick, and it can often be performed without dilating the pupil. OCT information really complements what a fluorescein angiogram shows us. Following macular thickness with serial OCT scans may be the best in-office test for trending wet AMD and really customizing patient care. Here's a case demonstrating excellent response to treatment with resolution of fluid. And sharing these test results with patients and their caregivers is a great communication tool. Everyone enjoys seeing leakage decrease with successful treatment. So remember, in-office imaging is key to helping get you from diagnosis to best outcomes.
I am a unique individual. My eyes are, and that's why it's so important to be looking at the test results and studying them to know what is the best treatment for me.
So, what we've learned together is that high-resolution imaging is key in accurately understanding your particular case. You're an individual, of course, and every case of AMD is therefore unique. Your retinal specialist can either cookbook patient care or, armed with information only obtainable by this special testing, get you on the best heading and keep you moving toward optimal vision. The investment your doctor has made to provide this office-based imaging is huge. Equipment leases, maintenance contracts, and the required staff add up to staggering overhead. Those costs only go up despite shrinking reimbursement trends. So, partner with your retinal provider and his or her staff as they work diligently on your behalf. It really is a team endeavor. We'll look at what is considered the most important driver of AMD in our next Discovery module. So make sure to join us. And remember, keep a steady heading and stay the course.